Inflammatory bowel disease. Inflammatory bowel disease is a group of diseases composed of mainly Crohn's disease and ulcerative colitis, where there is a chronic and relapsing immune activation and inflammation within the GIT. And this table compares the main features of Crohn's disease and ulcerative colitis. But both of them, there is bleeding in both diseases, and this bleeding can lead to anemia, which can affect our dental practice. And the second thing, because it's an immune disease, so we expect that many of these patients are treated with corticosteroids. What happens in inflammatory bowel disease, that there is an environmental trigger like acute infection or inflammation due to drugs or any other environmental trigger. This can lead to an acute injury, acute inflammation, and usually this heals completely. But in some genetically susceptible individuals, there is an immune reaction, a chronic inflammation, and we get up either with ulcerative colitis or Crohn's disease. The management, the dental management, we should make sure about 2 points in any patients with inflammatory bowel disease. Number one is anemia, which can complicate the chronic bleeding, and number two, the corticosteroid therapy, and these patients may need a supplementation with corticosteroids before dental treatment. In pancreatic disease, both the endocrine and exocrine functions are affected, and there is a possibility of bleeding tendency due to malabsorption of vitamin K, and secondly, there is a possibility of diabetes mellitus. In gastrointestinal tract surgery, where there is a resection of a part of the GIT, there is the possibility of nutritional deficiencies, and most important is the deficiency of vitamin K. We all know that vitamin K is used or needed by the liver in order to form the clotting factors. And in case of deficiency of vitamin K, we may get bleeding tendency. Jaundice. Jaundice is a symptom, or it's a manifestation, or it is a sign that's usually seen in the sclera of the eyes due to increased bilirubin level. Either a history of jaundice or actual jaundice is important to the dental practice. The causes are prehepatic, like hemolytic anemias, hepatic, like hepatitis, posthepatic or obstructive jaundice due to either gallstones or cancer head of pancreas. This picture shows the physiology of bilirubin. Bilirubin is the result of red cell destruction, and bilirubin goes to the blood, then it reaches the liver where conjugation of bilirubin occurs, then it is finally secreted or excreted in the common bile duct to reach the duodenum. In obstructive jaundice, the risk in dental management is number one, bleeding from vitamin K malabsorption due to the lack of the bile because of the obstruction, and number two, renal failure after general anesthesia, and this is called hepatorenal syndrome. The dental management: surgery should be deferred, and if delay is not possible, give vitamin K supplements in the form of injections and perioperative infusion of fresh frozen plasma, which contains, of course, the clotting factors. Avoid general anesthesia, but if in dental emergencies we need to do general anesthesia, which is very rare in dentistry, anyway, we have to treat these patients in hospital, and patients should be well hydrated with intravenous fluids and given osmotic diuretic mannitol to ensure a good urine flow. This should be done pre, per, and post-operatively to prevent hepatorenal syndrome. Gastroesophageal reflux, where there is reflux of the gastric contents into the esophagus. This may occur most commonly with hiatus hernia, non-fasting patients, pregnant women because stomach emptying is slowed and the esophageal sphincter is relaxed. And finally, due to obesity. The complications of gastroesophageal reflux. There may be aspiration of the stomach contents on the induction of general anesthesia, leading to pneumonitis, Mendelssohn syndrome, and uncomfortable supine position in the dental chair. Avoid the supine position of the dental chair in patients with left-sided heart failure, COAD, gastroesophageal reflux, late pregnancy. This is a self-quiz. Test yourself in these pictures. Try to mention the possible causes. Clubbing of fingers. Causes. Cardiovascular system causes, respiratory causes, and gastrointestinal tract causes. In the causes due to cardiovascular system, the hypoxic conditions like congenital heart diseases, bacterial endocarditis, respiratory causes like lung abscess, lung cancer, and GIT causes include inflammatory bowel disease, particularly Crohn's disease, liver cirrhosis, malabsorption, and gastrointestinal lymphoma. These are pictures showing pallor. Here in the tongue, in the fingers, pale fingernails, in the conjunctiva, and this is koilonychia, spooning of the fingernails, which is seen in severe iron deficiency anemia. Thank you very much.